Well, welcome everyone. As Luann said, I'll be the facilitator for today's conference. And my hope and really what I'll be trying to do is to really make this an important and meaningful and educational and hopefully motivational event so that we can realize some of the goals that Luann and Luann were talking about in terms of bringing Colorado into the forefront in its use of telehealth. So I think all is to the good here. So let's go ahead and get started. We've got some things moving around here, so I'm actually going to turn on this microphone and turn off that one because I need to be by the laptop, so just bear with me for a moment. Okay. As Luann was talking about, we've got a number of different things on tap for you today. We've got some terrific speakers. It's a rare occasion when I can actually get excited about a speaker and a topic just by looking at their presentations. But we've been working with their presentations and integrating some interactive polling into them, and I think that they're just going to be fantastic. So we've got 3 keynotes for you today and a series of breakouts. And then we've also got some time scheduled for some both dialogue in traditional sense using words, but also some interactivities in the keypads. And in just a couple minutes, I'll talk about how that's going to look. Let's spend about 45 seconds now learning how to use the keypad. So the governor of Colorado actually asked us to use these because they're having a little bit of a budget crisis, and so they would like us all to do our very best. No, I'm actually joking. What we'd actually like to do is I want to spend just a minute with you talking about how to use these devices, and really they're a technique so that this isn't just a one-way dissemination of information at a conference, because I think all of us have broad enough experiences that we want to contribute as well. So this provides a means to do that. So let me just give you a quick tutorial. Everybody should have in front of them a little blue device. It looks like a calculator. And really the only keys that you need to push today, except with just a few exceptions, and I'll be real clear about when those are later on today, are those the keys right in the middle that are circled in red, 1 through 9. So once you're at this point, we're ready to go. And it's very simple how you answer. So you really, I'll be asking a series of multiple choice questions, or the speakers will throughout the day. And all you do is you just push the number that corresponds with your answer choice. You'll be getting a little check mark in the upper right-hand corner of your screen that says that your answer has been received by the laptop up here using the radio frequency receiver. And after about 3 or 4 seconds, the screen will go blank. So it doesn't mean it's turned off. It just means it's gone blank and it's ready for the next question. All right. So change your answer as much as you want. Okay, let's do a quick practice question. So first practice question is, I have utilized telehealth technology to 1, receive health services. So if you want to say that, press 1. 2, provide health services. 3 for both. 4 for neither. I have yet to use telehealth technology. Or 4, neither. Forget telehealth. I'd rather tell a joke. So go ahead and push whichever answer best represents how you feel about this. And you'll note in the upper right that about 60 of you have responded. There's a little counter up there. And as long as that green box on the upper right is open, you can you can change your answer at any point or provide an answer for the first time. And I'll go ahead and close this so you can see what you all said. And it looks like 52% of you have never used telehealth technology. That's a great opportunity for learning here and to educate some new folks to help bring about the vision that Luann and Luann are talking about. All right. Next one is this technology allows us to do some cross-referencing based on some demographic characteristics. And so what we'd like to do is to both give you all a sense of who's in the room, from what part of the state or what type of occupation. But also a little bit later on, we might do some comparisons to say, people from the more rural areas, they tend to have a bigger concern about a certain type of aspect of telehealth, such as access to broadband or whatever. So what I'd like you to do is to look at these at this map and find where you live. So and remember the number. So just locate your county, and then figure out what number corresponds with that. And then the next question is going to ask you to enter that number. Okay. So take a look, find where you live, remember your number, and go ahead and enter your number now. So enter 1 for North Central, 2 for Northeast Plains, 3 Southeast Plains, 4 for Northwest, 5 for South Central, 6 for Southwest, or 7 if you're not from Colorado. So I'm going to close this in 3, 2, and 1. And it looks like 68% of you are from North Central. All right. With a pretty good smattering of folks from the rest of the state. So it is nice to have at least some people from every part of the state. That's a good sign, I think. All right, which best describes your occupation? Press 1 for clinical provider, 2 for health non-clinical, 3 health plan or payer, 4, education, 5, high tech, 6, civic nonprofit, 7, government, or 8 for other. And we'll close this in 3, 2, and 1. And it looks like most folks are clinical providers. I'm looking to see about health plan or payer 3. It looks like we have 8% of you from a health plan or payer. So it's nice to have those folks, especially considering the key role that Luann was talking about in terms of payment reform and uptake on telehealth. Next question is, what generation are you? It's a sly way of asking how old you are. So if you are a member of the GI generation, press 1, born between 1901 and 1924. If you are part of the silent generation with that age range, push 2. If you're a boomer, we always have lots of boomers, push 3. If you're a Gen Xer, 4. Or if you're a millennial, press 5. We'll close this in 3, 2, and 1. And it looks like we have a lot of boomers once again. No GI generation, maybe 1 or 2 from the silent generation, and probably 1 or 2 from the millennial. So pretty good age group mix once again, but just a lot of boomers. How optimistic are you that telehealth will be practically and broadly utilized in Colorado in the next 10 years? 1 for very optimistic, 2 for optimistic, 3 for neutral, 4 for pessimistic, or 5 for very pessimistic. And we'll close this in 3, 2, and 1. And my goodness, what a happy group here. What is that? 90% of you, or 89% of you, are very optimistic or optimistic. That's a very good sign, I think. All right. This question is we're trying to get a sense of what we really mean by telehealth. I did a conference not too long ago at University of Denver on career and technical education, which is radically changing these days. And nobody really knows what it means. So we did this similar exercise. We said, when you think of career and technical education, what is it that you mean? Well, this time we're trying to figure out what telehealth really means to you all, the people who are optimistic about its adoption over the next 10 years. And so we're going to give you a chance to choose 3 elements or 3 components that make up telehealth for you. So if telehealth, these are the possible answer choices about what could mean or what telehealth means to you. So first one is electronic transmission of medical data for diagnosis. Second is telephone or video conferencing for patient triage. 3 is telephone or video conferencing for patient treatment, monitoring, and or follow-up. 4, distance education, including continuing medical education, grand rounds, and patient education. 5, data collection and research. 6, electronic and remote health information and health data management. 7, tracking of patient movement and remote admissions. 8, all of the above. So go ahead and pick 3, and it's going to register the last 3 you pick. So if you change your mind, no problem. It's going to send the last 3 choices that you enter. And once you've picked your top 3, go ahead and push enter, and it'll come up here, and we'll see what you all said. Okay, I will close this in 3, 2, and 1. And it looks like the number 1 vote getter is number 3, telephone or video conferencing for patient treatment, monitoring, and or follow-up. And the next closest at 49% is all of the above. So it seems like there's a fair amount of agreement. The 2 that didn't quite get as much are tracking of patient movement and remote admissions and data collection and research. So good data in terms of helping to come up with some common vocabulary about what it is you actually mean. All right, next question. The most common way for patients to access telehealth services in my community is 1, telephone only, 2, dial-up internet, 3, broadband internet, 4, other internet, such as satellite or cellular or Wi-Fi, and 5 is don't use telehealth. Close this one in 3, 2, and 1. And it looks like for most of you, broadband internet is the way that you use it if you use it, but there's still a good 1/4 of you that don't use telehealth.